Hi everyone, my name is Megan Baxley and I'm with the local health department. I want to thank you all for dedicating this Saturday afternoon to spending it with me. If you or a loved one has been recently diagnosed with tuberculosis or you're undergoing treatment or you just have any questions and concerns that you might be affected by this illness, then this presentation is for you. My goal is to hopefully break this down into digestible pieces. It's really daunting. It's a really scary word. It's a scary diagnosis. So hopefully I just kind of want to put your minds at ease, answer any questions that you might have, and just break it down, provide some resources, that kind of thing. Okay, you guys? So we are going to just jump right in. So what is tuberculosis? So it is a bacterial infection caused by Mycobacterium tuberculosis. You might hear it as tuberculosis, you might hear it just as TB. That is how I am going to continue to refer to it as the presentation continues. It primarily affects the lungs, but it can also spread to other organs such as the brain, kidneys, and spine. So it's important that when we discuss symptoms, which is in the next couple of slides, that it's not just a respiratory illness. It can present in other ways, okay? And then TB can affect anybody. So CDC estimates that roughly 2 billion people are affected with either active or latent TB infection, and we will go over the differences between the two in a few slides as well. It is not discriminatory. It affects everybody and anybody. It is a bacteria that gets into your body and it wants to live. It wants to reproduce. And unfortunately, individuals are unlucky with it, but hopefully this decreases the stigma. You didn't do anything wrong. You're not dirty. It just happens. Okay. So how is it spread? So it is spread through airborne droplets, okay? This means that when you talk, when you sneeze, when you cough, and when you sing, little droplets that can hold that bacteria get propelled into the air and then other people can inhale it, okay? So this isn't spread by poop or blood or anything. It's just gonna be, those droplets or sputum, that kind of thing. All right. It can remain in the air for roughly 2 hours. So it's important when you're in really high risk settings like the hospital that you're wearing masks to protect yourself. Okay. How does it even affect us? Infect us. I kind of touched on this, but I just want to expand on it a little bit. So when a person inhales the bacteria, it can enter the lungs. In most healthy people, our immune system, kicks right in. We have mucus that traps the bacteria in our lungs, and then macrophages, which are like the good guys of our immune system, come in, eat it up, destroy it, get rid of it. Usually not a problem. However, there are people who are going to have a harder time getting rid of this infection, and we're going to touch on that, okay? Um, when the bacteria is able to replicate, then it can cause active infection, okay? And that means that you're going to have symptoms. So, who is most at risk of developing active or latent TB? Okay, so there's high risk occupations, right? Healthcare workers, you're helping people, they might have TB. Construction personnel, you are exposed to silica dust as you're working, which can break down your lungs over time, making it easier for a TB infection to occur. Correctional facility employees, you are in a location where there are a lot of people in a really small space. This, given the nature of how the bacteria spreads in the air, like I was talking about, it is very easy to kind of pass that illness around in those kind of situations. Immunocompromised individuals, if you have HIV or AIDS, or you're undergoing treatment for cancers such as chemotherapy, radiation, or you received an organ transplant like kidneys, liver, that sort of thing, you are going to have a harder time. Your immune system is just not what it used to be. And that's okay. We just want to make sure we're protecting those people. And then older adults, this is anyone ages 55 and up. A natural process of aging means that our immune system starts to decrease. Okay. So that just means, again, that we're not going to have a little bit of a harder time getting rid of that bacteria. Okay, what are we looking for? What is going to prompt me if you didn't fall into those categories? What is going to prompt me to seek medical attention? So, a persistent cough. This is a cough lasting anywhere from 3 weeks and on. Okay, it might be time to talk to a healthcare professional. Fever, night sweats, unintentional weight loss. Okay, not just weight loss. If you're trying to lose weight, congratulations. This is unintentional, meaning you didn't mean to. You haven't changed your diet, you haven't changed anything. Fatigue, chest pain. Okay? How do we diagnose TB? So we have a variety of ways. Some are better than others. A chest x-ray is a good one. Skin test, I only divide these into good versus bad. Some are just more definitive. Some you will need additional testing. So for example, the skin test takes purified protein derivative, which is a very fancy word for saying that we took some proteins from a bacteria, TB bacteria. So it's not an active, bacterial infection. And we inject a little bit underneath your skin and it forms kind of this blister looking bubble. It's painless. I've had it before. And then you return to your doctor's office in 24 to 48 hours. They look at the size of it. And then from there, if it exceeds a certain size, then they'll go on to do a blood test or a chest x-ray to determine, because that just means you've been exposed to TB in the past. You might have a latent or an active infection. And I know I keep saying those words. It's the next slide. So we will go over what that entails. And then the blood test, okay? This looks at whether you have antigens for the, so in other words, has your immune system been exposed to this bacteria in your body? And then a sputum test. Sputum is just kind of that mucousy spit, and that is only good for TB infections in the lungs. Okay, finally we are here. Latent versus active TB. So tuberculosis, when it is able to replicate and divide in the body, that means you have an active infection. This means that you are contagious and you will have symptoms. For people who have a tuberculosis exposure and it enters their body, but they have no symptoms, their immune system is able to kind of like, hey, I see you, we're going to stop you, shut you off, but you still have tuberculosis in your body. That means you have a latent infection, okay? And that means that you are not infectious, but you will still need to receive treatment because you may develop symptoms later on in an active infection if your immune system dips a little bit, okay? All right, treatments. So for active TB, they are long regimens. All these medications are antibiotics. They just vary on a timeline, okay? And your doctor will be able to help triangulate what is the best treatment option for you. For latent TB, so not an active infection, it is going to be a longer treatment, but it is going to be the same medications, which are all antibiotics, okay? So prevention. So you want to avoid contact with people who have active TB. If this is not an option for you, if you're working in healthcare, make sure you're wearing your PPE, your protective personal equipment, goggles, mask, the whole thing. Get vaccinated if there are vaccines available in high-risk areas. So like, are there a lot of infections in that area? Are you part of a vulnerable population? Do you work in those occupations? Do you have immune suppression, that kind of thing? Okay, it is not recommended for everyone. It is best to touch base with your healthcare provider. If possible, live in well-ventilated areas. And then you want to seek any medical attention if you are starting to experience symptoms of TB. All right, I felt this was really important to share. There is a video, and it will be in my reference section, of CDC's TB survivors' messages for TB patients. Someone said, my advice to someone who is recently diagnosed with TB would be to stay strong and use all of your resources. Educate yourself the entire time. Talk to your doctors. Demand the care that you know you deserve to get well. I think staying strong and surrounding yourself with people that care about you, you're going to need them to know that you're going to need help and support. And I would say first, go easy on yourself. You didn't do anything wrong. A bad, terrible disease picked you because you breathe and you need to take care of yourself. So this just kind of goes to show that, it is unprecedented. It can be really daunting, but it affects everybody and it's very common. And hopefully we can get you there's very good treatment options. Here are some resources that I'll leave up for a little bit for you guys to take a gander, and we can call back to that in the Q&A section. Some references, and I really just want to say a huge big thank you to everyone who showed up. Thank you for taking care of yourself, of your health, and prioritizing your needs. I hope you take it easy, and I'm looking forward to our Q&A section. Thank you.